Hello, my name is Carlin Luby, and this is my presentation for week 15. I have one note card here. There's nothing on the back. For this presentation, I chose to talk about Tetralogy of Fallot. It is classified as a cardiovascular disease, and it's actually the most common cyanotic congenital heart defect. It's associated with 4 heart defects. There's a VSD, an overriding aorta, pulmonary stenosis, and hypertrophy of the right ventricle. All of these problems together create a lot of issues for the baby because the body isn't getting enough oxygenated blood that it really needs. So with the VSD, or the ventricular septal defect, there's a hole in between the right ventricle and the left ventricle, and blood is just being shunted from the right side over to the left side, and then that deoxygenated blood is getting pumped out into the system. With the overriding aorta, the aorta is a little bit larger than it's supposed to be, and it's typically shifted over to the right. It'll communicate with the VSD, and then the aorta is pumping blood from both the left and the right side out into the system. The pulmonary stenosis occurs because the pulmonic valve is a little bit stiff, and that's creating a little bit of restriction or obstruction, and so blood can't really get into the pulmonary system in order to be oxygenated in the first place very easily. That stenosis is also creating problems for the right side of the heart, causing the hypertrophy, because that right ventricle has to work really hard and becomes enlarged in order to pump against the stenosis with that pulmonic valve. So again, all of these problems together really create significant issues for the baby. The body is just not getting the oxygen that it needs because too much blood is being shunted, and the pulmonic circulation is not getting the blood in the first place in order to be oxygenated. But these babies will typically present with maybe a bluish tint to their skin from the cyanosis, not always, but sometimes, and then you'll probably be able to hear a murmur on auscultation, and then the pulse ox will also be low. Additionally, these babies typically have very hyperacute cyanotic episodes that come when they're stressed. So it's maybe when they're feeding, or they're crying, or they're defecating. They just become very cyanotic, where they're breathing really heavy, they're irritable, maybe diaphoretic. And you have to put the baby into knees-chest position in order to increase the systemic vascular resistance and increase the pulmonary blood flow to get them the oxygen that they need. These are called TET spells, and in extreme cases, a baby could possibly go limp or become unconscious from them because they're just not getting the oxygen that they need. So it can be really scary. But Tetralogy of Fallot can actually be diagnosed while the baby is still in utero, so sometimes we'll know this ahead of time before the baby's born. Maybe with an ultrasound they might notice something a little funny, and then they can get a fetal echocardiogram in order to take a closer look at the structure of the heart and diagnose it before the baby's born. But if that doesn't happen, maybe these signs of cyanosis will lead the provider to order a echocardiogram in order to again look at the structures of the heart and figure out how the blood is moving and what is causing the cyanotic episodes. But that echocardiogram is probably the most important diagnostic test in order to diagnose this. If you didn't know ahead of time that the baby had Tetralogy of Fallot, one of the differential diagnoses would be transposition of the great vessels, whose main symptom is also cyanosis. But with transposition of the great vessels, it's a little bit different because the aorta is actually attached to the right ventricle, and then the pulmonary artery is attached to the left ventricle. So the deoxygenated blood from the right ventricle is getting pumped out into the systemic circulation, and then oxygenated blood from the left side is actually just going right back into the pulmonary circulation to be oxygenated again. But it's actually not as extreme as it sounds, because there's usually also a septal defect of some kind that causes a little bit of mixing with the blood. So again, it's not quite that extreme, but it is a problem. But back to tetralogy of Fallot, these babies will need surgery in order to repair the problem. Sometimes maybe surgeons might decide it's better to wait a little bit, and they'll do something like place a stent in order to increase pulmonary blood flow, and that's really a palliative measure until they can do the actual repair. But they will need surgery to repair these issues. There can be a lot of complications associated with tetralogy of Fallot, including death. You could have arrhythmias, blood clots, heart failure. They could get infective endocarditis. Again, it really needs surgical repair in order to avoid additional problems. But once these babies do have surgery, they'll need to be followed and monitored throughout their life, and they might even need another surgery later on to repair additional problems as adults. But this is a very serious problem that babies are unfortunately born with. It is congenital. They're not exactly sure what causes it. It may be the genes or chromosomes, but their environmental factors might increase the risk of it. Maybe family history could increase the risk. But they're just not sure exactly what causes it. But it is congenital, it's not acquired. These babies are born with the problem. And finally, tetralogy of Fallot is part of heart failure syndrome, and it is also part of pulmonary stenosis syndrome. But I believe that covers all of the topics for this presentation. Thank you.